The state of New Hampshire offers a state partnership marketplace exchange that offers the opportunities to individuals to shop the health insurance coverage under the Affordable Care Act. The New Hampshire Health Protection Plan is the expanded Medicaid under the Affordable Care Act. Individuals may qualify for an advanced premium tax or cost sharing to help pay their monthly premiums. When you get ready to sign up, you should bring your home address and mailing address, personal email, social security numbers, immigration documents, employer and income, policy numbers for any current health insurance plans. If you already signed up for healthcare.gov, you should bring your username and password. There are 3 ways to sign up: by phone, online, or in-person assistance. We have Spanish and Portuguese speakers too. When you sign up, you will receive your card or some other documentation that proves your enrollment. The card has your member number to identify you and the co-payments. The co-payment is the amount that you have to pay every time you go to visit your doctor. The co-payment amount is clearly listed in your card. To keep your coverage, you have to pay your monthly premiums.
If you're looking for health insurance options in New Hampshire, a great place to start is Covering New Hampshire. Here you can find information about the health insurance marketplace and New Hampshire Health Protection Program. If you are looking for some one-on-one assistance under Get Help, you can either look for an individual agent or find an in-person assister. They have a 1-800 number as well on their website, and that offers assistance 24 hours a day. A great resource for Medicaid is New Hampshire Easy. You can see if you qualify for assistance. You can get assistance with food stamps, child care assistance. You'd click here and then fill out an application.
A healthcare provider is any healthcare professional you will see in the healthcare setting. They could be a doctor, a nurse practitioner, a behavioral health professional, a nutritionist. So any of these professionals that you see when you go to see your doctor's office is a healthcare professional. You can find a primary care provider by calling your insurance and looking at the network of providers that are covered. You can also go on the internet to find this information. It is very important to find a primary care provider who fits your needs. Do they speak the same language as you do if you do not speak English? Are they a male or a female provider? Do they have work hours that fit your needs? Are they open late in the evenings? Do they work on weekends? Are they close to your home or your work setting? So it's easy for you to access their care. You can also talk to your friends and family to see if there is a provider that they see that fits your needs.
To prepare for your appointment, let us know that you're a new patient and that you are looking for a new primary care provider. Let us know that you would like to book a yearly exam or a wellness visit. Also, let us know what insurance you have, if you have any, and which provider you would like to book the appointment with. You should also let us know if you have any specific needs, such as interpretation. Also, ask us if you need to fill out any paperwork before your appointment. The way you get the most out of your appointment is by bringing your insurance information, your insurance card, a photo ID. If you don't have your insurance card, you could bring any paperwork you have that shows your insurance information. If you have your insurance card, we're able to get the correct information for the correct insurance to be able to bill that visit for you. It is important to come to your appointment 10 to 15 minutes earlier because you might need to fill out additional paperwork, or there might be a line ahead of you so that you're not late to your appointment. You could bring questions from home. Sometimes when you're not sure what to ask, you get intimidated by the provider. You could bring a pen and paper, and as you think of things while you're waiting for your provider, you could jot them down so that when they come into the room, they can address those with you. It is important to bring a family member with you because sometimes you forget things that your family member might remember, and they might help you to get the most out of your appointment. And don't be afraid of your healthcare provider. He or she is here to help you in any way they can. If you're not comfortable with the provider you saw today, you can always request to see a different provider at the same practice. Somebody you will feel comfortable with and you will connect with. If you need to cancel or change your appointment, please call us 24 hours ahead so that you do not get any cancellation fees.
If you ever have questions about your medical bill, you should contact the number that is on the statement that is sent to you from your healthcare provider. You should also receive an explanation of benefits from your insurance company that will give a summary of the services that you had provided, and it also identifies the balance that you are responsible for. You should keep all paperwork that comes from your insurance company. The explanation of benefits does identify what you owe, and when you receive the bill from your provider, they should match. So it's important to keep those papers together so you can understand. If there's ever a discrepancy, or if the explanation of benefits does not make sense to you, you should call your insurance company. But if you ever receive a bill from a healthcare provider that does not make sense, you should call the number on the statement. If you receive a bill in the mail and you have financial difficulties and you're not sure how to pay them, most healthcare providers are willing to work with you with financial services, as well as putting you on a payment plan. So don't ever feel that you should not get medically necessary treatment because you can't pay a bill.